Welcome to this Health Suppliers segment here on Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us on the program today. Our guest is Dr. Ellen Manos. She's here as a representative of JDS Therapeutics, a biotech company. I'll let her introduce herself and give us a little bit about her background. Welcome to the program, Ellen.
Yes, thank you. Good morning, and thank you for having me. I am a attending physician in obstetrics and gynecology here in New York City. Born and bred here and educated here in medical school. I have a 35-year experience in OBGYN, clinical practice at Lenox Hill Hospital, and a private practice. And with those 35 years, of course, I've been aging with my patients, going through a lot what they've gone through, and also learning along the way how to deal with issues from day one birth going all the way to menopause. So as a result, I've become very, very interested in dealing with the perimenopausal and postmenopausal patients. And JDS has come a long way in developing some good products for these women. So here I am to discuss things with you.
Now, these products that are developed by JDS Therapeutics, now they're a biotech company and you're a doctor advocate for them. Are these just regular pharmaceuticals? What are they made from?
Yeah, no, this is a good question. No, they're not pharmaceuticals at all. They are all blends, proprietary blends of very natural substances. Mm-hmm. These, the two in particular, actually there are three, but we can discuss them as they come along, but they are all basically designed as a alternative for women who either can't or don't want to use any estrogen preparations, either for menopausal symptoms, PMS symptoms, or certainly for things like vaginal dryness and other issues that peri- and postmenopausal women have to deal with. And for a long time, these kind of discussions were not being discussed with their OBGYNs, whether or not it was just because women were a bit skittish about discussing it. You know, it's a sensitive issue. It deals with a lot of, problems and sensitive issues that they don't want to discuss. And now that the discussion has come up, we've noticed over the past 5 to 10 years that women were really needing and almost demanding alternatives to hormone replacement therapy. And that's not to say that it is a bad thing. Hormone replacement therapy for many women is fine. But for those who don't want it or can't use it, a lot of these substances have been figured out and now marketed as an alternative. The two that I really do want to mention, Relazin, which is something for hot flashes, mood swings, and those kind of issues associated with peri- and postmenopause, has been in Europe, developed in Sweden for over 40 years. Millions and millions of women have gotten relief. And it's a natural substance made from a pollen, a plant pollen. They remove the allergic coating. And when they studied it first for memory, they realized that patients were getting rid of their hot flashes. And so they started, marketing it as a hot flash remedy, and it was considered a medicine in Sweden, so it went through rigorous trials there. And it was found very effective in studies, clinical studies, large numbers of women. And so now it's here in this country. JDS is, as I said, the main supplier of this substance, and it has no estrogens. It works up in the brain, not in the bloodstream to affect you in any way. And it really has been shown in clinical studies to be safe and effective. And it's been a godsend for women who really flashes, mood swings, sleep disorder. And as a result, they think clearer, they feel better. So this is one of them. The other product that, as I said, was marketed recently, and this is something for local use, the vaginas, as I was speaking about earlier, with menopause. It happens. It's something that is not negotiable. Some women can live with it. Some women can't. And most women shouldn't have to live with it. But as a result, estrogen creams can be used. The ones who shouldn't or won't use estrogen creams have this new product, this hyaluronic acid, which is a moisturizer.
Right.
And again, JDS had done its due diligence and has found that hyaluronic acid has been used, again, for 30, 40 years in dermatology. It's a natural substance that traps moisture. What to put on melts, and with use as early as 9 days, but of course, the longer you use it, like any moisturizer. I mean, honestly, we know as women, you have to keep using moisturizer in order for it to, continue working. But this is a fabulous product for women for moisture, and it's been, as I said, a very welcome addition to our armamentarium in treating women.
Before we go on, Doctor, in your experience, what would be the main reason that a woman would elect not to use hormone therapy? And in your experience, what would be the main reason that she could not benefit from hormone therapy?
Right. Well, of course, the hormone therapy is a really long discussion, and there's a big difference between local hormone therapy, meaning creams and gels for the outer area in the vagina, and systemic, meaning it's going, of course, into the bloodstream. The systemic hormone therapy discussion is ongoing. We have studies from way before the year 2000. Of course, the big study in 2001 was put out. And, there's issues with patient selection. So part of it is patient selection. Part of it is the women who cannot use estrogen for a variety of reasons, blood clot history, cancer history, breast cancer, uterine cancer, certain skin conditions. There are reasons why women medically should not take hormone replacement therapy. So for those women who want relief from systemic symptoms and cannot use it, of course, now we have this alternative in Relazin. There is really no reason why they shouldn't try it. Not a hormone. It doesn't bind to any hormone sites, and this is proven in studies. So then there's other women who don't want to take hormone therapy. Now, of course, that's a separate issue. They may not, just because they're afraid of it, whether it's rational or not. If they choose not to, they still may be suffering the same symptoms. And as a result, as I said, this kind of alternative is fantastic for them. Now, in terms of the local therapy likewise, there are some women who are told, do not use local estrogen creams for the dryness, for the symptoms of bladder problems, for the symptoms of, dyspareunia, painful intercourse. They are told by maybe their oncologist, right? They have breast cancer, it's early on, they're taking anti-estrogens, and a lot of the oncologists will tell them, absolutely no, we don't want you absorbing one drop of it. Whether or not they would absorb it or not is a separate issue, but if the doctors tell them absolutely no, they were stuck without any alternatives. And so now, again, there's an alternative for them. There's a whole set of other women who, again, don't want to use anything synthetic, natural. They don't want, synthetic or naturally formed estrogens because of philosophical issues, and again, that's a separate issue from the medicine. But having this alternative of the hyaluronic acid really is a fantastic thing because they have an ability to affect the change for their symptoms.
Well, where can we go and learn some more about JDS Therapeutics?
JDS is online. The products, themselves, JDS.com, but more commonly, as I said, if the patients are interested in any sort of product, they have fabulous websites online. There's Relazin, RELIZEN.com, which is, of course, the systemic one that I was telling you about, hot flashes, mood swings, etc. Revaree, REVAREE, is the hyaluronic acid, and they can, as I said, look that up online. There's extensive feedback mechanisms for patients to read about, clinical results, safety, customer reviews, and about the company itself. They could look it up. But they have developed these products in a way that is smart, it is thorough, it is based on good clinical studies, and that's why I'm one of their advocates. Myself and many of my colleagues here in New York City have been rallying for these kind of products for a long time, and we're very, very happy that they are available at this point. Of course, it all depends on the patient, and what they want to try, if they're compliant with it. You have to give these things a trial. At the same token, we are very happy with its development and with our patient feedback. It's been good.
Great. Well, thank you for coming in and sharing with us today, Dr. Ellen Manos.
Thank you very much for having me. Have a wonderful day.
You do the same.
Bye-bye now.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. For this Health Suppliers segment, transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. Be sure and visit our affiliates page when you visit our platform at hpr.fm.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.